And we know that by throwing the balance of the microbiome off or not having enough good bacteria, that can negatively impact the immune system.
Right.
Nutrient absorption is another thing that beneficial bacteria do for us and help play a role in our well-being. And as I mentioned, now much greater understanding between the gut-brain axis and how they affect how we think and feel. So really profound impacts on our health of a healthy microbiome and so much potential upside for probiotics. And again, topping up on the good bacteria. These specific strains have undergone testing. Again, we go back to that DNA mapping as well as clinical testing. In other words, there is
Right.
some research to suggest that yes, these will guaranteed to survive digestion. Yes, these will confer some health benefits, whether that is improved digestion or benefits for the immune system. There's been testing specific to these strains to show their benefit.
Welcome, everybody, to episode 163 of the Healthy Habit Podcast. I'm your host, Dr. Dayan of Healthy Habit Medical Center, and we're back with a check-in with Natural Factors, folks, representing, it's a Canadian company. Literally, it says product of Canada on their labels, so I'm going to love this company. I'm from Canada myself, for all the new listeners, and we got our great Dr. Kate Rhéaume checking in with us here for the week, author and naturopathic doctor, graduate and former faculty member of CCNM, the Canadian College of Naturopathic Medicine. Dr. Kate lectures internationally on many topics related to health and wellness, and she's a frequent guest on radio and television across North America. She's the author of the best-selling book, which I highly recommend you go out and buy this one if you don't have it yet in your health library, folks. Vitamin K2 and the Calcium Paradox, How a Little-Known Vitamin Could Save Your Life. And I'm thankful for Dr. Kate coming on the program here today, where we're going to break down probiotics and their role in health. So, Dr. Kate, welcome back.
Thanks, Dr. Dan. Good to be back.
Well, I'm excited to dive into this important episode. We have people coming in every day here, both the clinic and the health food store, looking for probiotics. And let's first start there. What is that, differentiating it from a prebiotic and a postbiotic? There's all these different biotics. What's going on? And then there's even
Yeah,
antibiotics, of course. So
right.
let's hear your thoughts on this.
Yeah, there's a lot of lingo, a lot of terms to be familiar with. Probiotics are beneficial bacteria that we can ingest, and then they do good things for us by mixing in with our microbiome and having a beneficial effect. So, of course, there's always a balance in our intestines between good and potentially bad bacteria. The good ones keep the bad ones in check. And so taking probiotics is a way of topping up on the good ones.
Great way to look at it, because we have a lot of bacteria in our gut, right? All throughout our body. I heard last time I checked, they outnumber us 10-1, bacterial cells versus human cells, right? So they start in the mouth and they go all the way through our GI tract. Is that correct?
That's right. Yes. And the composition of them changes a little bit throughout or quite a bit throughout the GI tract, as well as throughout life, as well as after illness or due to the effects of all kinds of things in our environment. So, and they really do make such a major impact on our overall health, our immune health, even things like mood, for example. So keeping your microbiome balanced and healthy, making sure the good bacteria outnumber the bad is really important, a foundational aspect of health.
And why would you say it's a foundational aspect to health? Let's go there. Like, what would maybe some key intro top, bullet points? Why would you say a probiotic is a must? It's a good thing to have on
Mhm.
the radar.
Definitely. Well, we know that healthy, balanced microbiome with lots of the beneficial bacteria, keeping the potentially problematic ones in check, is important for, of course, digestion. That seems obvious to most people, but what's not as obvious is the connection for our immune system, massive impact on our immune system. And we know that by throwing the balance of the microbiome off or not having enough good bacteria, that can negatively impact the immune system.
Right.
Nutrient absorption is another thing that beneficial bacteria do for us and help play a role in our well-being. And as I mentioned, now much greater understanding between the gut-brain axis and how they affect how we think and feel. So really profound impacts on our health of a healthy microbiome and so much potential upside for probiotics. And again, topping up on the good bacteria.
Really? So if someone's, let's say they're even eating a great, healthy, well-balanced diet, but if their gut health is off, like the bacterial health, specifically the microbiome, they may not even be absorbing all that properly.
Yeah, very much so. Yes, we know that probiotics are beneficial when it comes to absorbing minerals in particular, but they also make beneficial compounds, things like short chain fatty acids. These are sometimes referred to as postbiotics. So there's another biotic
Yeah,
term when the beneficial bacteria, go into our gut and make all of these beneficial compounds that ultimately have that, the good impact on us. Those are the postbiotics. That's what they're doing for us.
that's really interesting stuff right there. So perfect then. So like, and how when it comes to stomach acid, how do they get past that harsh environment? Can they survive that stomach acid? Like when someone takes a probiotic capsule, it's not getting destroyed by that stomach acid. Well, maybe some do if they're not properly designed supplements. But tell us about that. It's like a 1 to 2 pH, extremely acidic in the stomach. How do they survive
That's
that?
right. Yeah, and this is a really important question, and the answer to which has changed as probiotics have developed. So you're right, the stomach acid, extremely acidic environment, in part to destroy bacteria, because the stomach is designed in part to destroy harmful bacteria that you wouldn't want to be ingesting. And yet we know that some types of beneficial bacteria naturally survive that acidic environment. So if you eat certain types of fermented foods, sauerkraut, kimchi, pick your favorite fermented food, kefir. We know that some of those beneficial microorganisms naturally have the ability to survive digestion, make it through that acidic environment. So when probiotics first came to the market a couple decades ago, an enteric coating around the probiotic at the time was considered to be essential because we couldn't select in those days for the types of bacteria that naturally survive the acidic stomach environment. Now we
Right.
can. And so all of the natural factors probiotics, for example, use these specially selected strains that have been tested that they have that ability to naturally survive the acidic stomach environment and make it all the way through to the rest of the digestive tract.
Interesting. So it looks like on natural factors strains on the probiotic products that they're DNA mapped. DNA like deoxyribonucleic acid, like DNA
Mhm.
dash mapped. MAPPED. What does this mean exactly? And I'll have this in the show notes below, folks, if you want to just navigate straight to, you can see exactly what we're talking about here. DNA mapped probiotic strains. What does that mean exactly?
Yeah, this gets a little technical, but this really is state-of-the-art technology for the highest level of quality assurance when it comes to probiotics. And so these are beneficial bacteria, they have DNA in them, and that DNA, with very sophisticated techniques, can be mapped or sequenced, or basically you can check the DNA to make sure that the strain you have in your supplement is exactly the strain that you want. It's the strain that confers the benefits that have been tested and shown in clinical trials.
Right.
So this is really, yeah, it's a type of quality assurance, but not every company has the ability to do this. It requires very specialized testing, but it's a guarantee that you're getting exactly what you're paying for to have this specialized DNA mapping of your probiotics.
Perfect. So even though both Dr. Kate and I went through medical training, med school, we've worked with patients over the years. We're still not giving medical advice here. This is just educational purposes only, this podcast. But what we can discuss is our favorites, right? So some of our own personal favorites or things that we've used over the years with people, not saying that you need to start taking this. So can you tell us some of your favorite natural factors, probiotic products over the years?
I have a few, but I think probably in terms of general, you could say broad spectrum probiotic all-purpose support for most people in terms of health maintenance, the Ultimate 1212, that is 12 different strains at a guaranteed minimum potency of 12 billion live cells. There's a
Okay.
combination strains here. Some lactobacillus that have benefits for the small intestine. Bifidobacterium has benefits for the large intestine. So really to cover the whole length of the digestive tract at a useful potency. So for people with generally looking for the benefits of probiotics, this is a great place to start.
Perfect. I'll do a quick screen share here just to show all the YouTube viewers what we're discussing here. And for the audio listeners on Spotify, you can just head over to naturalfactors.com and then you can search the Ultimate Probiotic 12 by 12. Can you see this, Dr. Kate?
Yes.
Perfect. So we have the 12 billion live probiotic cultures and 12 strains, hence the name 12 by 12, 12 billion and 12 different strains, daily nourishment for intestinal health. Would this be on an empty stomach? How do you instruct people to take probiotics typically?
I usually tell them to take probiotics with a meal because that's when you'd
Oh,
normally be
okay.
taking in hopefully beneficial bacteria. And actually, when you eat, stomach acid comes up a little bit. It actually gets diluted by your food. So it's a
Right.
more hospitable time to be taking in these beneficial bacteria.
And then can you tell us a little bit about how these specific 12 strains are chosen? Like what are the goals by these? Because there's thousands, millions probably of different probiotic strains right by now. They're discovering new ones every day. But these have tons of research like the acidophilus, the rhamnosus version, the KC fermentum lactobacillus. So tell us a little bit about how they get chosen to be in the formula.
Yeah, so you'll see three parts to the name for each of these strains. There's the genus, the species, and then the numbers and letters after that at the very end indicates the particular subspecies. And so that is unique to the producer, first of all, of the lactic acid bacteria, as well as it shows that these specific strains have undergone testing. Again, we go back to that DNA mapping as well as clinical testing. In other words, there is
Right.
some research to suggest that yes, these will guaranteed to survive digestion. Yes, these will confer some health benefits, whether that is improved digestion or benefits for the immune system. There's been testing specific to these strains to show their benefit.
Amazing. They also have a 24 by 12 formula, but we asked for your personal favor. This is a good introduction into probiotics. I'll do that here. This is the 24 billion option right here, 24 by 12. And again, it's still 12 strains, but 24 billion different probiotic
And this
cultures as well. So,
Yeah, this is a
go
good
ahead.
go-to for people who have concerns around their digestion. So more than
Oh,
just
okay.
general health maintenance, maybe they have digestive concerns or immune health concerns. Then this higher potency, the double potency, confers more probiotics. You're getting more bacteria, and so that's a go-to for people with those kinds of concerns.
And tell us what would be some of those concerns to look out for, maybe gas, bloating, tell us about this. What are some issues you've seen over the years that probiotics have helped people with?
Yes, exactly that. Gas, bloating, whether it's constipation or loose stools, or that's something that tends to change depending on the individual. When somebody's under stress, a lot of people find that that can affect their digestion, throw their digestion off. Somebody in terms of immune health tends to have a weakened immunity, get sick a lot throughout the year, or maybe is in a situation where they're exposed to the public a lot and so needs extra support for the immune system. These kinds of things would point you towards this higher potency, the 2412 potency.
Incredible. So, folks, we're talking Dr. Kate Rhéaume here, episode 163, all things probiotics. We've already covered why it's necessary, differentiating between pre, post, and probiotics itself. Antibiotics are literally they're wiping out both good and bad bacteria. So maybe somebody that's been on a multiple rounds of antibiotics, do you think they might be a candidate? Might be, hence see my terminology.
Yes, they might be for the double strength we mentioned, 2412, or depending on the individual, their situation, it's possible that the critical care, there's even higher potencies, things like 55 billion. That may be a time that some people choose those kinds of higher potency strains as, say, post antibiotic therapy. That we've also seen post, H. pylori, this triple therapy where there's lots of powerful antibiotics being used here. That's a common situation where people may choose a higher potency critical care type formula.
Perfect. So, anything that I've missed thus far that you wanted to really highlight before I want to talk about different life stages of probiotics, or a quick summary so far? Anything on your radar?
Well, that's actually when you asked me for my favorite formulas, that's one I wanted to jump into is the seniors, but it sounds like that's where
Okay.
we're going. So definitely lots of interesting information there.
Perfect. So then let's go right into that then. So through different life stages, tell us about how important it is to adjust, because as we age, and a lot of people don't know this, that our stomach acid gets weaker with age, especially in the elderly population. And then you get a lot of antibiotic resistant bacteria that can form, and UTI infections over the years in people. So how important are probiotics through different life stages?
This is huge. We know that the microbiome does evolve throughout the lifespan, but that there is a change that can happen depending on the individual, can happen as early as, the 50s. Certainly by the time somebody hits 60, there's often a decrease in the beneficial bifidobacterium that we should find in the colon. Those beneficial bacteria are decreasing. They're being crowded out and replaced by more potentially harmful bacteria like E. coli, for example, strains in the C. difficile family. We see an increase of those harmful ones. And that overall can have an impact on digestion, again, on immune health. And that really relates back to this change in the microbiome. So the seniors multiprobiotic is 8 strains of just bifidobacteria. Again, that's to top up on those ones that we know and science has shown do tend to decrease with age to get those beneficial bacteria back.
Okay, and there's a specific, I'm looking for, oh, there it is, the seniors 35 billion 8 strain.
Mhm. Yes, that's the one.
Perfect.
And because it's so high in bifidobacteria, it's one that I also recommend, whether you're a senior or not, for people who are undergoing colonoscopy. So before or after,
Right.
to help replenish the healthy bifidobacteria in the colon is another time to think about this combination.
Are there any pieces of research on, because there's a really high level of colon cancer in westernized nations, any connection between that and probiotics that you've come across over the years, or a role that probiotics can play in preventing different types of GI cancers?
We definitely know that the very low intake of fiber is one of the contributing factors to that. And what
For
does
sure.
fiber do? It's food for our beneficial bacteria. And so you're not feeding them, they're not producing the healthy compounds that will support our immune system. And ultimately, that's going to have an impact on, immune health and things like colon cancer. And so there's definitely a connection between the health of our microbiome and those kinds of conditions.
Absolutely. What are some of your favorite fiber sources, Dr. Kate? When you say lack of fiber, I completely agree. You know, a lot of people, they're not getting enough fiber in the diet, and then they have to run and start getting psyllium husk ground up and start really pounding it
Hmm.
when they're trying to catch up after decades of lack of fiber and excess animal protein. So we're not saying go vegan here, but instead of just eating a big old steak, maybe having some beans, lentils, and veg on the side with it, right? So what are some of your favorite sources of fiber?
I think when people talk about fiber, they often tend to think about bran, which is like the flecks of fiber that you can see. That's
Right.
insoluble fiber. It's said to sweep out the colon. It's true, and that's important. But where we're really lacking often is insoluble fiber. So this is the invisible fiber that you'll find in things like legumes, whole uh, grains, nuts and seeds, green leafies, and other types of vegetables. And it will, when we consume it, bind with water, and that does all kinds of beneficial things for us. But specifically, this is what's called fermentable fiber. So it's a great food. It's a great prebiotic or food for our beneficial bacteria. It feeds them, and so it's focusing on the soluble fiber from foods like you mentioned, Dr. Dayan, or there's other sources as well. But definitely, you mentioned psyllium husk. You're right. That's something people turn to. It has some soluble fiber in it, but it's
Right.
often really can be irritating to the colon and a hard one for digestion for people.
And it could worsen bloating and gas and constipation if it's just all of a sudden introduced instead of gradually, right, into the diet.
Yes, not to mention the most common forms of it on the market have a ton of sugar added. Usually won't name any names, but
Yeah.
that's often the case.
So it says on the bottles here on the various Natural Factors probiotic products, like the 12 by 12, the 24 by 12, even this one that we just highlighted a few moments ago, the Probiotic Seniors version, which is designed for the aging gut. It says live probiotic cultures. You might have hit on this earlier, but let's do a quick recap. What does that mean exactly, live probiotic cultures? Does that mean it has to be refrigerated, or tell us more about that exactly?
Yeah, we didn't really touch on this
Okay,
too much. This is another
good.
term to be aware of when people are shopping, is the fact that these are live bacteria. Now they're freeze dried, so they are in a state of, you could say, suspended animation. They're frozen. They're not technically live in the capsule, but they will come back to life once they get into the gastrointestinal tract. And so that's important, and it's a measure of the potency. How many what are live, freeze dried, or sometimes referred to as colony forming units that can come to life once you ingest them. They're not live in the bottle or the capsule because that would be problematic. They're not going to eat one another in there,
Yeah.
but they will come back to life when you ingest them.
Okay, perfect. So, yeah, I mean, it's clearly important for health, probiotics. And then what happens is, tell us a little bit about this SIBO concept, small intestinal bacterial overgrowth, which has been picking up some steam here in the last 5, 10 years, even longer.
Mhm.
People that have been really deep in the health world for many decades, but especially now. What is this exactly? What's going on here with SIBO?
Yes. So we talk about bacteria through the length of the gastrointestinal tract, but really most of the bacteria is in the colon or the large intestine. SIBO is a condition in which you see an overgrowth of the type of bacteria that should normally only be in the colon, but they've moved up, and so you could say they've moved back into the
Wow.
small intestine where they really shouldn't be. And that causes problems, that it can affect immunity, it can affect digestion. And so getting those bacteria back into the colon and out of the large intestine and rebalancing that is really important. Probiotics, adding more beneficial bacteria in is a part of that. Certain strains like Lactobacillus plantarum, for example, you'll see that in most of these formulas. It happens to be especially good at crowding out unwanted bacteria or outcompeting the bacteria where they're not supposed to be. So going into the small intestine
Wow.
and out the bacteria that shouldn't be there.
Right. And then there's many reasons why they would start moving their way up, right?
Yes, very much so. Eating too frequently,
Okay.
something called the migrating motor complex. We won't get into that, but eating too frequently causes that, is one of the things that can cause that to happen.
Amazing. So, Dr. Kate, in your experience in the health world, how long should someone start taking probiotics before they notice any benefits? So, obviously it depends on each person, the stage of life they're in, but what are some common things you've noticed before the benefits start kicking in? What do you think about that?
I've had feedback from people that they've noticed a difference. So they feel a difference either in their digestion, overall well-being, or for women, if they're taking it for things like, yeast infections, urinary tract infections, that kind of condition. Within people have feedback within noticing a difference within days or a week or two. So it depends on the person, their condition, and what else is going on. And that's another area that I didn't even touch on yet is the women's formulas that are unique to and contain strains that are specifically beneficial for women's genitourinary tracts. And that's another area where there are special strains that have special and specific benefits.
Right. And men can still get UTIs as well, but UTIs mostly affect the female population. So, did you just hint that there's certain probiotic strains that can help with UTI prevention and treatment?
Yes,
Interesting.
especially prevention because they will help to say crowd out or on the wall of the urinary tract, crowd out the bad bacteria and prevent them so that there's no room for them to come back and stick back onto the wall there. And so getting in more of these beneficial bacteria. And again, certain strains have a specific affinity for that area of the body. These strains tend to be quite specific in their benefits, what they do, where they go. And that's where these specialized formula, like the women's ultimate and the women's probiotics formula, are targeted towards.
Amazing. Dr. K, what would you give us as a summary? We've hit on a lot of good This was like a good 101 on probiotics, we'll call that. The importance of having probiotics, why they're a foundational supplement someone might want to consider. We talked about SIBO, what's going on in there, the meaning of live probiotic cultures, and how they change, how the microbiome changes through various life cycles. So you even highlighted your favorite probiotic, the Ultimate 12 by 12. And then if someone's actually having symptoms, they might want to bump it up to the 24 by 12. You also broke down how specific strains are chosen to be in the various formulas. I mean, there's a lot of good takeaways from this one. So what would you leave us with? What should somebody really know here, consumers, as they're listening to us shopping in the store here today?
We want to be eating more fiber, consuming ideally fermented foods, but the probiotic supplement then can make a big difference in topping up and maintaining that balance in the microbiome, and that not to be intimidated by all of the different terms and how complex or confusing actually it can sometimes seem when shopping for probiotic supplements. But that's why I recommend for people to be shopping in a place like the Healthy Habit where they can get their questions answered. Hold the bottle and ask, what about this? What about that? Especially with probiotics because they can be complex. But this is good information to cover the bases here.
Well, thank you for putting up with all my questions. There was a lot of stuff there that I just threw at you, and it's going to help a lot of people. Dr. Kate, what would you leave us with as a resource or takeaway? Where can people find out more about you or Natural Factors?
Yeah, people can reach me at www.drkateND for naturopathic as well as find out more about the formulas we're talking about at www.naturalfactors.com.
Okay, Dr. Kate ND, and I'll include this in the show notes below and then naturalfactors.com. Those are two good takeaways. So thank you again, Dr. Kate, for your time and the whole team there, Chanthi and Jeanette. We appreciate y'all. Appreciate it.
You're welcome. Thanks, Dr. Dayan. Take care.